Hey Miss Odom, this is Kylie Laycox, and today I'm going to be showing you how to do a head, face, neck, and regional lymphatics assessment. And today my patient will be Ethan. Okay, the first thing I'm going to be assessing is the size and shape of his skull. So I'm going to place my head in his scalp and on his skull to see if it is smooth and symmetric. He has normal protrusions at the forehead, each parietal bone, the occipital bone, and each mastoid process. There is no noted tenderness upon palpation. So next I'm going to assess his temporal artery. Okay, upon palpation of the temporal artery, there was no tenderness, no hardening of the artery felt, and the artery did not look tortuous. So next I'm going to assess his temporomandibular joint. Okay, open your mouth. Good. Okay, close it. Good job. Did any of that feel tender?
No.
Okay, good job. So his movement was smooth. There was no tenderness as he stated. His joint had full range of motion and there was no crepitation noted. Now we're going to move on to the face. So now as I'm assessing his face, I'm looking for symmetry, which is present. There's no abnormalities noted, such as coarse facial features, exophthalmos, no changes in his skin color or pigmentation, and there's no abnormal swelling or facial tics present. So now I'm going to move on to the neck. As I'm going to assess his neck, I'm going to be checking that his head is midline, symmetric. Okay, which it is. I'm going to assess that his neck muscles are midline, and they are. And his head is erect and still, which is good. Okay, so now I'm going to ask him to tilt his chin to his chest. Good, now turn your head left and to the right. Okay, now can you tilt your ear to where it touches your shoulder? Good, now the other side. Okay, good. All right, now tilt your head back for me. And as he is tilting his head back, I'm going to be also assessing for a swollen parotid gland. Okay, and I don't see one. Good. When he extends his head backwards, the movement is smooth and controlled. There's no rigidity, or limited movement present. So now I'm going to assess the cranial nerve 11, which is the accessory muscle nerve, to make sure it is intact. Okay, Ethan, shrug your shoulders. Okay, good. I'll place my hands on your shoulder, and I don't want you to let me lift up. Good. Okay, now I'm going to check your sternocleidomastoid muscle. So you're going to turn the opposite way of my hand. Good. Okay, now we're going to check the other side. Good. As he is turning and extending his head, I am simultaneously assessing for enlargement of the salivary and lymph glands, which none was noted. And there's no swelling below the angle of his jaw and no thyroid gland enlargement present. Now I'm going to move on to assess the lymph nodes. The first lymph node I'm going to assess is the preauricular. So when assessing the lymph nodes, it's important to gently palpate them and do it in a gentle motion. Okay, so these are the preocular. Good. Now I'm going to go back to the postocular. And then the occipital, the submental, the submandibular, and the jugulodigastric, the superficial cervical, and then the deep cervical, and the posterior cervical. Good. And now I'm going to check the supraclavicular. And I'm going to do this by asking Ethan to shrug his shoulders. Good. And I don't feel any enlarged lymph nodes. So next I'm going to assess his trachea. We're going to be assessing for midline placement. And to do this, I'm going to place my finger in the external notch and slip it to one side. Okay, good. There's no deviation noted and symmetry was present. There is no tracheal tug and it did not push to either side. Okay, and the last thing we're gonna assess is the thyroid gland. So we're gonna ask our patient to sit up straight for us, and we're gonna use the fingers of my left hand to push the trachea slightly to the right. Okay, good. Now swallow for me. Good. Okay, you can feel the thyroid move up as your fingers are on the trachea. And now I'm going to do the same thing with the other side. So I'll put my finger on this notch and push it to the other side. Okay, swallow for me. Okay, good. Then I also feel it move up again. But now in most people you will not be able to feel the thyroid. If enlarged lobes are present, they will be easily palpable before swallowing or tender to the touch. If the thyroid gland is thought to be enlarged, it should be then auscultated for a bruit or a soft blowing sound. A bruit is an abnormality and could indicate hyperthyroidism. That concludes my head, face, and neck and regional lymphatics assessment. Thank you for watching.